Yes.
Now let's talk about diabetes mellitus, and let's welcome Ma'am Esperanza de la Cruz. Good evening, Ma'am
Good
SP.
evening, Doctor.
Okay, can you tell us what is the definition of diabetes mellitus?
Diabetes mellitus is a chronic medical condition characterized by high level of glucose in the blood. In TCM, it's known by the Xiao-ke syndrome. It means wasting thirsting disorder.
Okay. What are the two types of diabetes and different?
The two type of diabetes are type 1 diabetes and type 2 diabetes.
Okay. Can you tell the difference?
Yes, type 1 diabetes, the symptoms include excessive thirst, frequent urination, unexplained weight loss, fatigue, and blurred vision. They usually develop rapidly. While the type 2 diabetes symptoms develop slowly and may include thirst, frequent urination, fatigue, and slow one healing.
Okay, what happens in type 1 that doesn't happen in type 2?
In type 1, mas ano po siya, mas mabilis nalalaman ang pagiging diabetes because of sa family history. Ang type 2 is developing slowly.
Can you develop type 1 even if you're already 40? Or you develop it much, much earlier?
Ang type 1 is developing much earlier. Sa type 2 ay hindi po. Nalalaman po to at the age of the 45, middle age, 45 years old.
Ang type 1?
No, type 2 do. Ang type 1 po is sa early at childhood po.
So, ibig sabihin, we already have destruction of the so-called beta cells, no, that produce insulin. So that's what makes it type 1. And type 2
Yes.
can happen at any age, can be diagnosed at any age. Okay?
Yes. Yes, Doc.
Now, can you tell us the different patterns in TCM for diabetes?
The different patterns of diabetes can be categorized into virus pattern based on the underlying disharmony affecting the body's chi and blood. It's a pattern diabetes, mellitus lung and stomach heat, spleen chi, deficiency, phlegm dump heat, liver chi stagnation, kidney yin and yang deficiency, and blood stasis.
Okay, thank you very much. Can you tell us what lung heat with fluid damage
The lung
manifests?
Yes, the lung heat with fluid damage manifestation, dry cough, thirst, shortness of breath, chest discomfort, dry skin and mucous membranes, frequent urination, fatigue and weakness, fever or sensation of pit tongue appearance.
Okay, what's the treatment principle for lung heat with fluid damage?
The lung heat with fluid damage principles, clear the heat lungs, nourish body fluids, support the lung function, balance the kidney.
Okay, very good. Now let's go to stomach heat excess, yung parating gutom. Can you mention other symptoms here?
The excess thirst, increased appetite, dry mouth, frequent urination, irritability of agitation, bad breath and mouth sores, constipation, gastric discomfort.
Okay. Treatment principle for stomach heat excess.
Principles. The stomach heat principles, clear stomach heat, Our stomach and spleen generate fluids, regulate the middle jaw, harmonize and moisturize the intestine, address underlying deficiency.
Now let's go to kidney yin deficiency. What are the manifestations?
The manifestation of the kidney yin is the heat sensation, dryness, weakness and fatigue, dizziness and tinnitus, thirst and urinary, reproductive and sexual, and chi and blood.
Okay. Treatment principle for kidney yin deficiency. Very easy.
Sa kidney.
Anong treatment?
To tonify the kidney, nourishing.
Okay. Now let's go to chi and blood deficiency. Mention mo to kanina. What are the manifestations?
Chi and blood manifestation of the it's
deficiency. Napakadali niyan.
It's general fatigue and weakness po, Doc.
Okay. To end, is it possible to have 10 patients with diabetes, but the approach of treatment will be different?
Again, Doc?
Let's say meron kang 10 pasyente, may diabetes. Does it necessarily follow na yung treatment mo pareho for the 10? Or will
No,
they?
Doc.
Okay.
No, Doc.
So thank you so much, Ma'am SP.
Thank you, sir. Thank you, Doc.
Congratulations.